Welcome to the Low Carb MD podcast. No one is beyond help. No one is beyond hope. Nothing said on the Low Carb MD podcast is medical advice. Please consult your own doctor before making any lifestyle changes.
Welcome to the Low Carb MD podcast. My co-host, Dr. Brian Lenskis, is not here today, and he's going to be hating on himself because we have an amazing advocate in the health freedom space. I know he's a big fan ever since he saw her documentary a couple of years back that really changed the way he started looking at things. We are so happy to have Leslie Manookian here today. She is a fierce advocate for medical and health freedom. She left her career in Wall Street. She made an amazing documentary, and now she is the head of a not-for-profit and is spearheading some of the most important legal cases in medical freedom right now. So I am super, super excited to have her join us today. And we're going to have in the show notes how you can support her, how you can sort of stay, informed about what's going on and the future of the cases. She's had an impact in Idaho. She's had an impact for all of us. And we were talking about this before the air on us as physicians and the medical community at large, and just the lay public at large, and how we're going to maintain our rights against seemingly um, a big sort of medical industrial complex that's just coming for all of us, unfortunately. Super excited to have you, Leslie, here. You know, maybe what we could start with is, why did you leave Wall Street? You could have just taken fat checks. You could have sat at home. You could have not done any of this. And I'm sure there's a lot of heartache and a lot of people coming after you. You know, we talked about censorship before we came on the air. Why are you doing all this?
Yeah. So one thing that we forgot to say, Tro, is the federal travel mask mandate.
Yeah.
Health Freedom Defense Fund, the organization that I founded in 2020, is the organization that struck down the federal mask mandate. So you don't have to wear a mask on an airplane, train, bus, anywhere like that because of us. And that case was actually my idea because most people don't know this, but CDC is a advisory agency. It's not an agency that's supposed to be making any kind of, well, first of all, it can't make law. Only Congress can do that at the federal level and our state legislatures at the state level. It's supposed to promulgate rules that are based on the power that's been delegated to it by Congress. And I knew that was wrong because of my documentary. Am I allowed to say the V word on your podcast?
Just whatever you want. Like we are, yeah, we've talked about myocarditis. We've talked about, the strokes from the J&J vaccine. We talked
Okay.
about the fact that in the entire medical community supported the vaccine even before they saw the data. We've talked about it all, and please feel free.
Yeah. So I made a documentary film on vaccines, and I'll go back in a second and answer your first question. But that is what prompted me to then go and start challenging all these things. But I knew from making the documentary on vaccines and all my research, the CDC didn't have that power or authority to tell tens of millions of Americans who fly on airplanes what they can or can't do with their bodies. And that's why we challenged it and we won. So in answer to your first question, I had all these experiences that sort of suggested to me that there was corruption and that I should be really cautious, and that maybe what was going on in the business that I was in wasn't certainly not in service to humanity, and it wasn't even perhaps ethical. And so I left business school and I went to go and work for Goldman Sachs in New York. And then they transferred me to London. And I was living in London, and there were just things that were conflicts of interest that I didn't feel good about. And so I ended up quitting. And I thought it would be less conflicted if I went to go and work for one of my clients, which was one of the biggest investment managers in the world. And so they hired me to be a telecom and technology analyst. And within 10 months, I was appointed director of research. And then after that, I ended up becoming the director of both the European growth portfolios and the director of research. So I was running the entire European growth business for Alliance Capital in London. And in that capacity, I was responsible for ultimately choosing which stocks went into our European, our international, and growth portfolios. Here comes my tea.
No, I'm curious, I'm curious
So
why you're
to all of
getting
your listeners, it's early and cold here in Idaho, and so I needed some hot tea.
it's cold here in New York. It's like 60 degrees now.
Yeah.
But so I'm just curious. So you're hustling. I mean, you made it, quote unquote. Like people would kill to sort of be in this sort of leadership position where they're able to make a good living and like I just help people understand what makes somebody say enough is enough.
Yeah. So uh, I'll just tell you a side to this story is that I came home. I think it was December of 1999. No, it was December of 2021 and 2000. Sorry. I came home and my husband said, "Did you get your bonus?" And I said, "Yeah, I did." And I remember I was like opening the refrigerator and he said, "Well, what was it?" And I told him the number and he was just like, and I started crying, Tro. And he's like, "What is wrong? Are you upset?" And I was like, I'd just been told I was going to make more money that year than I thought I would make in my lifetime. And I said, "No, I'm empty," because I had money and position and power. And I was 37 or 30. Yeah, I guess I was 36 years old. And I knew that wasn't making me happy. All those
Do,
things.
do you
And
think
so let me
do you
just
think most
combine, let me
people
finish the story though, because it's so important. And I think you will be aghast. I don't know if you've heard the story, but so basically what happened was the CEO, the CFO, the head of R&D, and the head of investor relations all came into our offices one day to reassure us about their stock. Their stock was getting crushed in the stock market because rumors were trickling out of their phase 3 trials, which your listeners probably know about. Those are the final stage of clinical trials before a company can apply for licensure from FDA. And rumors were trickling out that some patients had died. So the market's down, the stock is down 25 or 30%, and the company is going around to visit its biggest investors to reassure them that everything's okay with their blockbuster drug, which is the reason we all own the stock. And he comes in and sits down, okay, in very rare instances, a few people have died, he says. Rare instances. When have we heard that before, right? And then he looks at me across the table and he says, "The bad news is the FDA is going to make us put a black box warning on the packaging. The good news is we still think we can do 7 billion in peak sales." And I was just absolutely, literally, I mean, I remember feeling like someone had kicked me in the stomach. I was like, oh my gosh, they're going to kill people and they know it. And I'm supposed to be okay with that. And after the meeting, I just went to my office and paced back and forth, kind of freaking out that what I was hearing and what I was seeing. And then I went into our pharmaceutical analyst office, and I'll just call her Jane. And I was like, "Jane, this is wrong." And she just looked at me and shrugged her shoulders like, "Yeah, what do you want me to do about it, lady?" And it was just one of those moments that was life-changing, because I had seen lots of things in the past that indicated to me that companies were bribing governments and doing things that were clearly not above board. And I just felt like, whoa, I am playing for the wrong team. I am on the wrong side. And the combination of those two events, having that kind of realization that money, position, and power didn't buy happiness, and then this that I'm playing for people who are going to injure and kill people. I couldn't do it anymore. And I sort of started planning my exit. And I got pregnant not long after that. And after my son was born, I quit. And I committed the rest of my life to making a difference on the planet and playing for humanity, trying to make the world a better place for my son and for all the other young people, and fighting back against what I knew was, just utter corruption.
What an amazing story, by the way. And I had heard that. I think you had mentioned that on one podcast. And yeah, I'm just curious, being a physician and, a lot of physicians listening into this podcast, was that a lifestyle drug? Was it like a depression drug? Do you remember what it was? You don't even
Oh, I
remember.
know exactly what it was. I've been very deliberate in not mentioning it because
You could just give us like a class, like a hepatitis C drug,
then you'll be able to figure it
2011.
out. Let's
Oh,
just
okay.
say it's a drug that's supposed to help your heart. I'll just say that.
Okay. Got it. Okay.
I know, I know.
Yeah.
Jack Cruz has been saying that he thinks it's Vioxx. It's not Vioxx.
If it was 2011, if it was like 2010 or 2005, yeah,
It's
certainly not
earlier.
wax. Oh, yeah.
Yeah, but I'm not going to say any more than that because I just don't need more people harassing me. And I know people who have died for doing what I do. So,
Yeah. Yeah. And I think it's tough to understand for people who have very sort of strong feelings, I guess you say, for humanity, that the way that they describe deaths in clinical trials is like an asterisk. There is a drug right now that is in phase 2 trials. It's to gene edit your cholesterol receptor permanently so that your cholesterol remains low. And in phase 1, right, there was 2 deaths, right? And if you think about it, the company was bought by Eli Lilly. The name of the company is Verve. Um, and if you think about it, well, what's propagating this? It's this dogma in medicine, thinking that lower cholesterol is the fountain to youth, and here they are searching for a fountain to youth, essentially stuck in dogma, literally killing people to advance this idea or to explore this idea that lifelong lowering of cholesterol is a panacea. And I find it hard. I think most people out there just don't understand that these people have no issue, right, breaking eggs to make an omelet or whatever they think an omelet is. It's like nothing to them.
Tro, they will, that's just, oh, well, they'll say it was just not unexpected. That's what they will say. Well, you're just going to get a few deaths background rate. No, 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 no. And aside from the fact that cholesterol is produced by every cell of our body, just because you can somehow artificially reduce the reading of cholesterol doesn't mean you are changing anything in the body. And let's not forget that the entire story that saturated fat causes elevated cholesterol, which is then dangerous, is a lie. That's just provably false. We know this from dozens and dozens and decades of studies. And that the women who have the highest levels of cholesterol, women who have 800 levels of 800, they are the longest lived. So what we understand about cholesterol is completely wrong. It's like shooting the messenger, right? But your point is that they are looking at some surrogate measure as it's just because they can manipulate it. That's why they do it. And that's the same thing that happened in this drug. They knew they could manipulate something in the body to give you a better reading on something. And they then conflate that with an improved health outcome, which is completely false. But they just then spin this story to the public that it's all about this one metric, which really is not indicative of improved overall health. And the problem is that I think doctors are just too busy. I mean, you tell me. I think they're just too busy. They can't keep up on, there's something like more than 1 million studies, papers published every single year. How can they possibly know everything? And so then what they do is they fall back on relying on these industry trade groups, because that's what the AMA is, that's what the AAP is, that's what the APA is. They are all industry groups that represent and take the money of the pharmaceutical industry. And so there's just this vicious cycle. And I don't even know if you know this, but
We're gonna be best friends. We're gonna be best friends. You said the all the three-letter words I hate. So just to share, just to share, and the listeners know this. Last year we wrote a intense criticism of the AAP. The AAP says, you need 23 lab tests and a radiographic test to lower kids' diets, but please lower the sugar in kids' diets, but give them surgery and give them GLP-1 drugs. That's the AAP. The APA, I mean, I lost trust in them when they basically approved waterboarding for political reasons, and their guidelines on toxic masculinity, which they backtracked, I think just shows there's some sort of entrenchment there that's untrustworthy. And then the AMA is it's a nightmare. I mean, they've had more articles on climate, on the equity of placental transplants for transgendered women, right? This is a true, in the AMA Journal of Ethics. This is an article, and how they should ban red meat and limit childbirth for climate reasons, right? These are all things put out in the Journal of AMA, and so all of these organizations, I found a hard time just. I have to fight against them. In the testimony that the Fluoride Action Network did with the AAP, I was just floored. The question was so simple to the AAP expert, which was, if it was very clear that fluoride lowered IQ, which it is, by the way,
100%.
uh, uh, would you recommend against fluoride? And the physician from the AAP said, no, I would not recommend against fluoride. I mean, these are, I'm going to ask you a question because,
Tro, I have to take two things to
yeah,
that. The AMA, well, first of all, the AAP literally has functions where in the past, where they have had Coca-Cola prominently displayed as a sponsor. They have taken millions and millions from the pharmaceutical industry in order to build their new headquarters. This has all been documented. The AMA puts out a journal called JAMA, right? The Journal of the American Medical Association. Guess what percentage of revenue from JAMA comes directly from reprints? And I'm sure your audience knows what reprints, right? It's when they pull out a study that's been published in their journal, and then they put the glossy cover on it and they send it to tens of thousands of doctors all over the world. They get paid by the pharmaceutical industry directly to do that. And guess what percentage of their revenues comes directly from reprints?
let's say 80%.
I think it's 40 or 50%. Lancet is 40 or 50%. I can't remember which one's 40 and which
It's a
one's
joke.
50. It's a joke. My point is, even what you're reading, this whole concept of peer-reviewed research, it's farcical. It's whatever is politically acceptable that gets printed, and the journals know who's buttering their bread. It's the pharmaceutical industry, and so the whole thing is just this circuitous racket.
This is tough for people to understand. I think you have to be a little bit awake, right? Let's say you're the lay public, right? And you're out there and like what you're reading from, MSMBS is like that, there's a company making a cholesterol lowering drug and you should be excited about it. And, to trust your doctors, right? Your doctors have board certification. So, and trust the organizations, right? So, how do we start to sort of wake up the public? I mean, this is something that's interested me. You started sort of waking up the public with the documentary, And now you've gone to government and policy, and you're bringing these things to court, which I think is badass. So how do you wake up the public? Do you think it's a combination of all these? Do you think more resources should be spent, in litigation like you've done? I think some of the litigation that you've mentioned and others that I know you're on, I mean, these things are huge. They give us as doctors at least some leg to stand on when we say this is nonsense, right? So I'm just curious, like if you could, where would you have people advocate towards? Like how would you move this advocacy community?
So first of all, I mean, I think it's just one person at a time, and I think that the last 5 years has been the biggest own goal or shot in the foot that's ever occurred from the mainstream medical model. And so I think that's a huge gift to all of us who have been working. I mean, I've been working in this space now for almost 25 years to try and wake people up that you have been deceived, that these shots that they inject into your baby on day one or into you when you're pregnant are health promoting. They are not. They include all sorts of toxins and dangerous chemicals and ingredients that you should never inject into a pregnant woman, let alone a human being of any kind, or a newborn baby or a 2-month-old baby. And I didn't believe this at first. I was getting flu shots, just so you know. In my mid 30s, I was getting flu shots. I had no idea that there was some problem with them. But then I got really sick, and I started. Somebody told me that I should go and see a homeopath or an acupuncturist. In fact, it was my mainstream doctor in London told me to go and see a homeopath. And I did, and it was a life-changing experience, so much so that I started studying homeopathy. And that, I raised my son exclusively on homeopathy, and I know there are all these people who say, oh my gosh, it's quackery, it's hocus pocus, it's this or that. It is the most powerful medicine I have ever experienced in my life. And the reason that it has been so derided by the mainstream medical model is because it's a threat to the mainstream medical model. The very first medical institution in the United States was the American Institute of Homeopathy. And the AMA was founded a couple of years later in the mid 1800s in response to this. My point of all of this is that we do this by educating people. And the problem is that people don't understand that the mainstream media is not the news. Now, seriously, really take this in. The mainstream media is propaganda. And I don't mean that in some horrible sense. It's just that it's the propaganda arm of the government and the corporations. And they are selling you something. It's like the same thing as the advertisements that you see when you watch television. It's just repackaged as the news. And so if there's a paper, some kind of a study that comes out that contradicts the narrative that the corporate sector and the government wants you to know, it will not make it into the news or into corporate media. It will only be published and then very reviewed by people like me who go and look for it. And so the onus, I think this is the most important thing, the onus is on each and every one of us to stand up and take responsibility for our own lives. And this is why the vaccine debate is so critical and why it's been resisted, I think, so strongly by even the people for so long. Because who wants to actually assimilate the simple truth that you and you alone are responsible for your life, that you can't outsource these decisions to your doctor because your doctor doesn't know. Your doctor has been indoctrinated in med school. And I'm sorry for all the doctors who are listening, but that's the truth. No one has ever proven that it's safe to inject thimerosal into human infants. No one has ever proven that it's safe to inject aluminum into human infants, or polysorbate 80 or polyethylene glycol or any of the other things that they're included. No one has ever done this. And so ultimately, we have to realize that our lives are our responsibility. And so that's my big message. It's twofold. One, you need to take responsibility. And two, I try to My mission at Health Freedom Defense Fund is to educate the public to the point where we establish a societal norm of medical and health freedom. We and we alone get to make our medical and health choices, and then to codify that in law. So if you understand that your health is your responsibility on the one side, and then on the other hand, you have the freedom to make those choices, which is the way it should be in a free and just society, then we will be in a different place. And I think that it's incumbent upon all of the advocacy organizations to push those ideas as well at the same time, so that people do wake up. But it needs way, way more reform. We can't be, as we've been doing, subsidizing corn, soy, canola oil, sugar beets, right? All of these things. We need it. It just takes a whole scale effort at the federal level. But I think that each of us individually can only do what we can do. And to me, that's about educating people. And what's happened now with the last 5 years is that people are waking up to these notions, and they are taking more responsibility. They are saying, you lied to me about masks. You lied to me about distancing. You lied to me about the dangers of COVID. We knew from the Princess cruise ships that the death rate was around 1% in the elderly. We knew that. And yet they lied to about this. They lied to us that the shots would stop transmission and infection, that they were safe, that they were effective. And so now people are really, I think, anyone who is moderately aware has seen some of the stuff on social media. I think that's the other thing is, I know that we're derided for getting our news from social media, and you do have to be careful because there are lots of bad actors on social media. But if you go to the good independent actors on social media, they are actually sharing genuine, good research with you. I think those are the ways we do it. We just have to bypass the mainstream medical or media complex because it's not telling you the truth, Tro.
So my foray sort of into medical freedom probably came 20 years ago when I was a intern, and this is coming on like 15 years ago, was when I saw the changes in the mandates for influenza vaccine reporting by CMS. So I saw the whole, situation unfold. I saw it even before that, getting into, working in a nursing home, how nobody even required a hepatitis B vaccine, and then all of a sudden it was starting to be required, right? So I saw these rules unfold with very little data to support it. So I was exposed to it. I saw these things unfold, and it pretty much all comes from greed and hegemony. Like if you look at it, it's authoritarianism, which I think is a value set difference, really. But my entire career, the last like 10 years, I focused squarely on developing those doctors. You said like, we are solely responsible for our health, and I couldn't agree more. But I feel like it's an unfair fight. Like it's an unfair fight for the average person right now to go out and take responsibility. There's so much propaganda. Their doctors are brainwashed. Their nurses are brainwashed. The school nurses are brainwashed. The Department of Health is brainwashed, right? And it goes all the way up to the AMA and the CDC. A lot of it is just value set differences, one, and honestly, buying the Kool-Aid, right? And you mentioned the Kool-Aid. Actually, in the first part of our discussion, you said it's surrogate endpoints, right? So a lot of the harm that's come from medicine is believing that surrogate endpoints does something, right? And how do we as a professor, let's map this out just one step further, right? It's when a doctor believes that lowering your blood sugar in and of itself will improve your health, or lowering your cholesterol in and of itself, or lowering your temperature in and of itself. It will help improve your life some way. And that's not necessarily true, right? I can lower your blood sugar by giving you chemotherapy and making you nauseous. I can lower your cholesterol by making you malnourished, right? I can give you an autoimmune disease and your cholesterol will plummet. that doesn't mean that I'm necessarily improving the quality of your life or that I'm actually helping you. So the more we get doctors to understand that you have to prove real world results in your own patients, right? Then this is the key for the medical profession to really just transforming, right, in a way that's positive. I think the problem is the average person, like you and I are, we've been gifted with the ability to be curious, the ability to learn about it, maybe to have a little bit of financial freedom. I don't think most people out there, I mean, I think everybody aspires to be their own health advocate, but like I can't be the advocate for my car. I mean, I take it to the mechanic, and how do we, but I do agree with you. I think we have to inspire the people that are helping others to change. And we need to wake up the public that you can't just buy into the narcissism that exists pervasively in the healthcare community here, that they know what's best, they don't admit mistakes. I mean, it's a joke. I saw the two people that left CDC and I watched some of their interviews, and these people are warped. I mean, warped. Like
That guy, what's his
seriously,
name?
pathologically warped.
Yeah, what's the
Dimitri.
guy?
Yeah.
Dimitri. Oh my God.
Yeah.
Yeah. So,
So
Tro,
yeah, I'm curious what you think.
yeah, there's so much that you just said there. But the thing is, the average person can't change what's being taught in medical schools. The average person can't change what's being published in the medical journals and the scientific journals. The average person can't even change what the doctors think. The doctors are so indoctrinated and I think inculcated with the idea that they are above the people that they have lost all humility and all connection to their patients. Not all of them, but in general, I think this is unfortunate. What the average person can do is to advocate for themselves and educate themselves. And the first thing that you need to do in terms of advocating for yourself is to eschew, literally, turn off the television and stop watching or reading anything out of the mainstream. Because if you're seeing it in the mainstream, it's because somebody wants you to see it, not because it's actually good for you. And so I don't know if you know this, but I'm on the board of the Weston A. Price Foundation, which is it's really the original kind of traditional nutrition foundations in the country, and it's dedicated to teaching the work of Dr. Weston A. Price, who was a dentist who lived in the early part of the 20th century. He traveled the world and to try and find out if there were any people on the planet still exhibiting perfect health. And he wrote the most amazing book called Nutrition and Physical Degeneration. And it's all about how these quote unquote primitive people in 14 societies around the world who were cut off from the foods of modern commerce, from just the modern world in general, and were still eating their traditional diets, had perfect facial structures. They didn't have a narrow face like I do. They were broad at their temples, at their cheekbones, and they had big, broad faces. They had wider noses, broader palates. They didn't have crooked teeth. They didn't have collapsed. They didn't have lots of cavities and things, caries. They were able to have healthy, normal childbirth. In fact, one family he studied, the woman had 24 children. She would just push the babies out in bed at night while her husband slept next to her, literally. So the point is that within one generation of eating sugar and processed flours and industrial oils, seed oils, one child who grew up eating their traditional diet would still exhibit perfect health, and the child who grew up in the port where he was eating all the garbage would have a collapsed facial structure. This is what happens, okay? My point is that the Weston Price Foundation.
That's supported. Just for the listener, just so you know, he really made it clear that it was absolutely sugar and processed carbohydrates, but it was the absence of nutrients, right? That really made disease. And he was really looking at sort of oral health, but most of modern disease can be explained by this phenomenon.
Yeah. And so back then, so he was the president of what became the American Dental Association, and he had 60 or 70 scientists at his disposal. And I'm telling you, any of your physician readers, physician listeners should go and buy his book, Nutrition and Physical Degeneration, because you can see all of his studies. It is unbelievable the work that he did. It is literally the seminal work ever done on nutrition, ever. And back then, people were eating 10 times the level of healthy fat, saturated fat, and then A, D, and K. And they were eating 4 times the minerals, I think. I always get it confused if it's 10 times the minerals and 4 times the fats. But if you look at the nutrient density of the foods they were eating, they were getting 4 times and 10 times as much of the A, D, and K and the minerals as people were getting in the 1930s. Not today, the 1930s. And we know that our soils are depleted of all of these kinds of nutrients. So that's a really important piece to understand. And I'm also bringing this up because Weston Price, if you go to our website, Weston, which is WESTONA, price.org, we actually have a program for people who are on low budgets. You don't have to be rich. You don't have to be educated. You can start educating yourself through organizations like that. You can read books like Nina Teicholz has written and, the work that you're doing. My point is, it's your responsibility. Most people go and do some research on the car seat they're going to buy for their baby, but they don't research the shots they're going to inject into them or the food that they're feeding them. And we know that the ultra-processed foods that people are feeding their kids are reprogramming their brains. All you have to do is go to the independent organizations and read what they have to say, and you will start to educate yourselves. There's another great repository. Do you know about greenmedinfo.com?
Yeah, but you can tell, but yeah.
So this is a place where you can actually read the scientific literature, at least the abstracts and articles about them, that all support independent ways to keep yourself healthy. It's the stuff that never makes it to the light of day in the corporate media. And so to me, this is what we have to do. We, as a population, have to take responsibility for ourselves, to educate ourselves, and to make choices for ourselves and our family. My son will be 23 in September. He has never had fluoride in his mouth. Never. Because I knew about this years ago. He, if he's ever been sad about something, I never took him to the doctor so he could get a drug, a psychiatric medication, because I read the literature 20, 25 years ago about how they were rigging it and what they were doing and how these psychiatric medications actually, especially in young people, increase the risk of suicidal ideation and homicidal ideation. They increase it. Any thinking person who read this stuff would be like, I'm not going anywhere near with that with a 100-foot pole, not a 10-foot pole. My point is, it's incumbent upon them. And then you doctors out there, this is a call to you. You cannot hide behind, it's too hard for me, I take insurance, whatever. This is on you. You make choices every single day. Do those choices truly support your patient's health or not? If it's just because it's easy, that's not an excuse. You can't use that as an excuse. And someday there's going to be some kind of, I believe, judgment of each and every one of us. And it's up to us to decide whether we're going to play for the good team or the bad team. That's it.
Judgment is coming sooner than later, and not in a spiritual sense, in a real sense. I mean, look, my entire career, I've spent time to say, I am going to show my patients what happens in our clinic. Right? I'm literally going to analyze my own self, good or for bad, and we're going to put it out in the medical literature. Because I don't want, I've taken no insurance contracts ever, no Medicaid, no Medicare, never signed an insurance, never, no money from pharma, no money from supplement companies, no money from homeopathy companies, no money from anybody ever, never a kickback. And what I've done is I will show you what we do. What's the weight? When somebody comes to my office, what is their weight 1 year later? What is their A1C 1 year later? What is their cholesterol, triglyceride look like 1 year later? What is our quality of life? We actually assess quality of life. Why would you go to a doctor? You know what I don't understand? Why people go to their doctor and they have no idea about them? No idea,
But
right?
Tro, it's
Why
worse
do I
than that.
see them?
Yes, but it's even worse than that because what I'm saying is, yes, people can't, no human being, and I'm not saying just in front of God, I'm saying that you ultimately have to be, comfortable in your own heart about what you did. And you know what they say is that ignorance of the
Not.
law is
They're
no
not.
excuse. Well,
Listen, I've gotten
ignorance,
so many calls. I've gotten so many calls over the last 5 years. I can't even count. I want to say over 500 calls from doctors out there who said, Tro, I don't know what's going on. I don't know if I can fight this. I'm a CMO. I'm a CSO. I'm a, healthcare leader in my hospital. I don't know what to do. And I'm not saying that like they didn't have courage. They just, for whatever reason, good or for bad, it was hard for them. It was hard, and it's a huge struggle, and I don't blame them. I don't blame most people, for not sort of making some of the choices that maybe you and I would make. But
Tro, I'm not blaming them. I'm saying
yeah,
it's their responsibility and it's on their conscience and on their heart. And if you prescribe medications that harm people because you didn't educate yourself about the downside, you can't just say it's standard of care. I'm sorry.
yep,
You can't
yep,
just say it's
yep,
hospital protocol. I'm
yeah,
sorry.
yeah.
You
It's
are responsible.
you got to say I effed up. I effed up. That's my fault. I did it, right? I made the mistake. And I think that most doctors out there, they don't have that. They don't have, yeah, I think you mentioned this, the humility and the humanity, right? To be able to do that. And we need to bring humility and humanity back to medicine.
Yeah.
I think that's what's gonna make medicine great. I'm hoping I can be involved more with the HHS. They have a healthcare committee that I'm hoping I can be a part of because we need to power every doctor right now to be able to say, here's how my patients do, right? And we need to be able to compare. You need to be able to compare, like, why should somebody listen to me? Right?
Yeah.
I need to be able to show them like this is why. Here's my outcomes. Here's how people fare when they come to see me. I mean, gosh, when I go to a restaurant, I check the Google reviews, right? Like, I mean, I try to eat at home, obviously. I check the Google
Yeah.
reviews. How is the service? We can't do that in medicine. We can't say how many medications did it take to make that person happy versus
Yeah.
how many medications it took in this clinic. How many medications did it take to help somebody's with weight or with diabetes in one clinic versus another one?
No, but how
Right?
about how many medications does your doctor prescribe? How about
Yeah,
that metric?
that would be amazing.
How
Yeah, that
about
would be
how
amazing.
about how many patients has your doctor lost? How many? I mean, but the thing is,
Yeah.
again, it's on the individual. It's incumbent upon each and every one of us to take responsibility. When my son was little, I mean, we did not eat out. We had the means to eat out. We did not eat out. And when I say eat out, I mean in good restaurants, not in, all the fast food junk. And I'm sorry, it's junk. We did not eat out because we didn't eat GMOs. We didn't eat pesticide laden foods. We didn't eat seed oils. We didn't eat, all the processed foods and junk that's out there. We try to eat a grass fed, only grass fed meats, only raw dairy, only whole foods, vegetables. My son never ate pizza till he was 8 years old. He wouldn't eat hamburgers and hot dogs because he ate what we ate. We'd go into a restaurant. I remember we'd go to this one restaurant that was like a local food, and he would order, and I'm not kidding you, when he was 4 years old, crab cakes. And the person would be like, "What? Doesn't he want little kids' food?" No, he doesn't want little kids' food. He wants real food. And
My
my
kids are the
point is,
same.
my son, when he was 7 years old, 6 years old, he'd say to me, "Mama, wouldn't it be so nice if we could just go and eat out anywhere and we would know that the food was good?" And I would say, "Yes, it would be, honey. But
We're
that's
gonna
not the
make that.
world."
Hopefully, we'll make that happen.
And
Hopefully, we'll
that's,
make
but
that
that's
word
not the
happen.
world we live in now. And so my point is, as more patients vote with their feet and leave their medical doctors and seek holistic health outside the medical system, these doctors will have a comeuppance. They can either choose to be part of the problem or part of the solution. And that's what they are. That's their own choice at some point. And the patients are leaving. Thankfully, we have an amazing health secretary in Bobby Kennedy, who I've known for a long time. And I think that he is doing an amazing job. Talk about a blood sport, being in DC. I can't imagine how hard it is for him every single day, but he's doing unbelievable things. And I just think ultimately we can't blame the other person. We have to take responsibility. And I think that applies equally to the average layperson, and it also applies to doctors and professionals.
Here's the one problem I have with the take responsibility, and I agree with you. Even though I agree with you, the problem is right now the active person is being harmed by the CDC, the AAP, the AMA. We need to develop organizations like the Weston A Price, like the Society of Metabolic Health Practitioners, which I'm a part of. We need to develop these organizations so that people get reasonable information, get good information, get good help. They're not actively harmed.
No,
Right?
this is what Health Freedom Defense Fund does. We educate, we advocate, and we litigate when we have to. But the point is,
talk about some of the litigation, because I think I think like I want to know more about this, because I know you won a case in Idaho. I know the other case you just mentioned. Can you talk a little bit about sort of what how you view the role of litigation as a part of this sort of crusade to really get our whole world healthy?
I don't think that we can sit around waiting for government to solve this problem for us. And you're part of something that is making a difference. I'm part of many things that are making a difference. I'm just saying that people need to seek the independent information, because I don't think the government's going to solve this problem for us. And as much as I appreciate what Bobby's doing, I think that there are huge forces aligned against us. And he's going to be gone in a few years. And there's no way he can resolve or solve everything that ails government and all of the misinformation. He doesn't run USDA. He doesn't run EPA. He's not in charge of all those things. And he doesn't run everything. He's not the president. So he can't do everything. And there's a huge bureaucracy in place that implements a lot of these programs and that answers to industry. And so I think it's much bigger. And I think ultimately our country was designed for people who take responsibility for themselves. So I think that's really important. I'm not saying that we don't try and work from both angles. I just don't think that there's going to be a quick fix from the top. I don't.
Yeah.
So in terms of the litigation, so one of the first lawsuits we filed was against the Los Angeles Unified School District because they mandated the emergency use authorized shot for all employees. And we sued. I think we filed on March 17th or 18th of 2021. And the very next day, the school district said, it was just a guideline. It wasn't really a mandate. You can test instead. They basically rescinded. And then they deceived the court. They represented to the court that they did not have a mandate and were not working towards a mandate for the shots in order to get the case dismissed. And so the judge dismissed the case, saying that there was no longer a ripe issue for the court to adjudicate. And then 17 days later, they filed a new case. They filed a new exemption. They implemented a new exemption. And that, I'm so sorry. 17 days later, they issued a new mandate, the Los Angeles Unified School District. So we sued them again in November of 2021. And that case is still working its way through the courts. We lost at the district court. We won the appeal. Then there was a petition by the school district for what's called an en banc review. We just lost that. And so we're likely going to take it up to the Supreme Court. What's just shocking about this, Tro, is that the Ninth Circuit just issued a ruling which says that the school district didn't need to know whether or not the shot stopped transmission or infection. It just needed to, as long as it could have believed that the shots helped individuals, that's all that mattered. They didn't need to know that they stopped transmission or infection. There didn't need to be a true public health implication. They just had to believe it was going to help individual employees. This is so outrageous. It's actually lowering the bar for what's been deemed appropriate public health law for 120 years. I just don't think we can let that stand. So I think we're going to have to petition the Supreme Court. So those are those two cases are super important. Then the mask case, we filed the mask case, which stopped the federal travel mask mandate in 2022. We have sued Disney and forced them to settle when they were treating their employees inappropriately, basically denying medical, religious exemptions, fired employees for exercising their rights to those exemptions. And we have sued the University of Chicago for denying conscientious belief exemptions under their existing law. Right now, we have a case against...
And you in New York State? Because New York State is a joke, you know? New York State is a joke. We need you in New York State. Yeah.
We haven't done any in New York State so far, not for any particular reason, but just because the cases that have come to us have been more out here. But
Mike Lawler, the congressman here, he launched a lawsuit against the governor because she wanted indefinite detentions during quarantines and public health measures. So very thankful for Mike Lawler for doing that. Unfortunately, he lost.
And Bobby Ann Cox, she's been instrumental in that. She's an attorney and she's a friend of mine. Yeah, I mean, they wanted what Kathy Hochul has tried to do is just outrageous. It's incredible. But we also sued the federal government over the green card. They were requiring the COVID shot until this year, until our lawsuit, requiring that green card applicants from abroad have proof of the COVID shot in order to apply for a green card. So we got rid of that. We sued the federal government over their federal contractor mandate of the COVID shots. We sued it over their federal employee mandate of the COVID shots. And we've got a new case that we're getting involved with, suing the city and county of Santa Clara for denying medical exemptions to a valued employee and then firing her. We have that. And then, oh my gosh, we've got a case against Nike. And we have a couple other things that we're pursuing too that I'm not able to discuss right now.
How can I throw money at you? That's what I want to know. How can I? Because we need this. We need people out there fighting some of this stuff because people don't understand. There is an authoritarian culture, and I think it's truly a value set difference. They know better. They know what's right. They know what's right. They're out here for everybody. They have science, right? This is the sort of, we're fighting that culture, and that culture will not give up. Like if you think you're right and you think you're helping society by forcing 5-year-olds to get myocarditis, there's no and you don't fundamentally view it a problem that I'm causing somebody myocarditis. I'm lowering somebody's IQ and I'm going to force them to do this. They don't see the humanity in that.
Yeah.
You cannot win against this. So I want to, how do I throw money at you? That's what I want to know.
It's even worse than that. Here's the thing. What they're banking on is that there are no Leslie Manookians and health freedom defense funds in the world. That's what they're banking on. They're banking on the average person not being able to fight back, not being able to mount a lawsuit, not being able to challenge them. And I've proven in the last 5 years with all these wins that actually, and our money comes from individual donors. We have some, foundations that support us, but literally it's from people who just give us money in order to help them. People who know about my movie, they know about my work for the last 25 years, and they have backed me. And once we started winning, they were like, okay, this is a real organization that's really trying to change the world. Something else I haven't even mentioned, I just have to say this. I got involved here locally in Idaho about 15 years ago. And this past spring, I passed the Idaho Medical Freedom Act. I wrote it and presented it to the legislature, and it bans mandates, medical mandates in the state of Idaho for almost everyone. This is the kind of work that we need to do. And this is why I'm saying we need to take responsibility individually and engage. We need to run for the school board. We need to write letters to our local newspaper. We need to run for city council. We need to get involved and show up, because if we don't show up, then these people can do whatever they want. And that's what's happened. That's why the US is in the shape it's in, because we have taken our eye off the ball. We've been apathetic. We've not been engaged. And it's incumbent upon each and every one of us to show up and say, hey, no, 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 no. You are not going to put a boy on my daughter's team. You're not going to put them in her bathrooms. You're not. This is only happening because parents don't get involved and don't show up. And so that's one aspect. So the way that you can support us is by going to healthfreedomdefense.org and signing up for our newsletter, sharing our work. We send our newsletter out about once every 2 weeks. We don't bombard you daily with something. You can become a member, and we're developing different tiers of membership for people. Right now, it's just a one-time $10, but we're going to have different tiers, which you'll get different access to different materials and potentially to workshops with us. And then you can donate. And the thing is, all the work, just so everybody knows, I have worked for free for over 20 years. I have not taken a penny for the movie, for making the movie, for all the work I've done, advocating, traveling, for all the work I've done for Health Freedom Defense Fund. I mean, we're talking at least 100,000 hours of work, probably 200,000 hours of work in the last 20 years. I do it all volunteer because I'm doing this to make a difference. I'm doing this for my son and for my future grandchildren and all the other young people who are literally going to live in a dystopian world if we don't stop what is being foisted upon us. And so, I mean, I'm grateful for all the $10 donations, and I'm grateful for all the $100,000 donations. Anybody who wants to support this work, I mean, I thank you from the bottom of my heart, because I can't do it. I don't have the money. I have the money and a husband who pays the bills for me to do this work without being paid, but I don't have the money to fund it. And it comes from people who are passionate about this work and passionate about freedom, passionate about truth, and passionate about justice. And I want to help every person I can who just wants to have healthy kids and who wants to live free and who wants to be able to go to the restaurant because they decide they want to go out for dinner one night and it's not going to poison them and their children. That's what I want. I don't want our kids to be injected with poisons. I want us to be free and live in a fair and just society where we all get to eat good food, where our kids are healthy, our adults are healthy, people live to the rightful old age without dementia because they're not being poisoned and because they have the proper nutrients that they should have. That's their birthright. That's what I want.
And to that, Leslie, and we're happy here to join in with you on the nutrition front, the metabolic health front. Certainly Brian on the spiritual front and the healthcare freedom front. I know he's going to really be upset that he missed this.
Well, we'll do it again.
Yeah, I'm so happy that you came on. I'm so happy to connect with you, and I just, love the fact, you inspire me. We're sort of back channel in some of the same groups, and just it's so inspiring to see so many people attacking the same issues from so many different ways, and keep doing what you're doing. It's just, know that there's people out here that you're inspiring that you didn't even know about, like me.
Yeah. I didn't even know about you until I mean, I'd seen your name on the thing, but I didn't know who you were until you reached out. And thank you so much for what you're doing and for taking a stand. And thank you for giving, me an opportunity to share my work and, with your audience, because it's so important. This is how we change the world. We don't expect that it's going to happen from the top. We do it one person at a time on platforms like yours with people who are courageous enough to say, hey, I am going to take a stand on these issues, so.
Luckily, our listeners have woken up over the last, 5 years. 7 years ago, when we said that diet and mental health were linked, we had doctors saying our licenses should be revoked. And I think
have they not read the gut and psychology syndrome?
They haven't read much. Let's just put it
Yeah.
that way. I
Yeah.
mean, you could see it today. Bobby Kennedy said, he's just alarmed when he goes to the airport. He sees so many kids suffering with mitochondrial disease, mitochondrial dysfunction, and everybody's like, what's this mitochondrial dysfunction? And literally, I just posted this graph. Go to PubMed, type in mitochondrial dysfunction in quotes, and you'll see what it is and how much research there is behind it. And yet people try to make it like mitochondrial dysfunction is a conspiracy. We're dealing with a system that needs to be toppled, and it's a value set difference that we'll never reconcile. So we
Yeah.
need people like you and me to just keep fighting. And when they see your kids healthy, my son, who's 13 right now, at his age, I was 110 pounds heavier than him, right? I was a 210 pound, 220 pound 13-year-old kid. I was a 350-pound board certified physician, right? And I had to take responsibility for myself, but luckily I had good help and a good peer network and a good group like the SMHP. Nina Teicholz is a good friend. Eric Westman's a good friend who really sort of helped guide my way to health. And now I'm honored to be able to do that over thousands of patients. We've lost 100,000 pounds in a clinic.
Wow.
And yeah,
Yeah.
I mean, that's that. And hopefully, I can help the federal government. We can lose millions of pounds. So that's my hope. So I
Yeah.
hope the federal government can change. That's my hope.
I have something I want to put you forward for, but I will text you offline about this. And I just want to say, if you're a physician and you want to understand what's really going on, but you don't want to be, you want something that's accessible, then watch my movie, The Greater Good, which you can find at greatergoodmovie.org. It's not going to shame you. It's just going to help you to understand. And I can just tell you, we won an award from the School of Public Health at the University of Alabama, Birmingham, for the film and for our treatment of this important issue. It is super accessible. You just need to go out there and educate yourself. And then you will start to see. And you know what? You can tweak things. You can start actually educating yourself about nutrition. Go to the Weston A. Price Foundation. Go to the organizations that you're involved with, Tro, and start giving your patients other ways to get themselves healthy and well. I have a saying that health doesn't come in a pill, bottle, or syringe. That's not where it comes from. And I think that if you really think about that, you'll probably realize that too. Okay, I have
So,
to.
yeah, I know you got to head out, and thank you so much for coming on. Thank you to the listeners, and we'll put all the links in the show notes. Just, click donate, support her. We need to support each other, guys, if we're going to make change. Thank you again, Leslie.
Thank you.
If you enjoy the show, please consider supporting us on Patreon by going to lowcarbmd.com.